I'm present. This is Harold Ethic. My presentation is on the impact of multiple relationship in counseling. My name is Florence Bisanga. I'm presenting on multiple relationship impact to counseling. As quoted by Arnold Lazarus, he stated that setting boundaries and ethics can diminish therapeutic effectiveness. Yes, that is true. When the therapists go out above his expectation or the boundaries in which uh, the purpose of the relationship was created, it can backfire or it can cause problem. And it is said that a therapist should avoid stepping over the boundaries as their boundaries because they want to avoid any problem. Consider forming multiple relationship can only be when the the ground of the relationship is of the benefit of the client and there is no um, uh, back a motivation on it. As a psychologist, psychologists should refrain from entering into a multiple relationship if the relationship could reasonably be expected to impair the psychology, objectiveness, competencies, or effectiveness in performing his or her function as a psychologist. In multiple relationship, it can create conflict of interest, boundaries violation, confusion, and even power of imbalance. So, in this area, we are looking at the area where before a therapist engage in such um, relationship, which is more than one role carried out with a client. This client should be involved in the discussion. The client should know have the reasons why such relationship is going on. The client should even sign an informed consent in case of any misunderstood or understanding. Uh, it will be that the patient was informed and accepted. And as a psychology going through a multiple relationship, it should be of the best interest of the client. There should be no um, area of exploitation or harm to the client. We are there to support the client. To promote a well-being of a client, a therapist are challenged with balancing their own values and life experiences with ethics code as they make choice regarding how to best help their clients. Related to the code, good judgment, the willingness to reflect on one's practice, and being aware of one's motivation are critically a dimension of an ethical practitioner. Sometimes some warning signs can be failed to understand. They may not pay significant attention to the potential problem involved in establishing and maintaining professional boundaries. A behavior becomes unethical when it reflects a lack of awareness or concern about the impact of the behavior on clients. When the therapist places his or her own personal needs above the needs of the client, encouraging in more than one role with the client to meet their own financial, social, or emotional needs. It is unethical in the code of professional aspects. In cases where the client suffer harm or exploitation due to multiple relationships, the client should file a malpractice lawsuit against the mental health provider. Hedman 2006a suggested that it is wise for the counselor to avoid multiple relationships to the extent possible and to document precautions taken to protect clients when such relationships are unavoidable. Although the code of ethics of most professionals caution against engaging in non-sexual multiple relationships, such relationships exist in most settings and are not necessarily problematic. Some of the relations are beneficial. Example, mentoring. This involves a binding role. The mentor and the learner can certainly benefit from the relationship. Ethical problems are likely to arise if the mentor role becomes blurred so that he or she is more of a friend than a mentor. The practitioner must discuss with the client the potential problem involved in multiple relationships, and it is a good practice to actually involve the client in the discussion making process. If the multiple relation is judged to be appropriate and acceptable, the therapist should document the entire process, including having the client sign an informed consent form. Risk management appropriately should be adopted in case of any problem. This involves reviewing the various issues such as diagnosis, level of function, therapeutic orientation, community standards and practice, and consultation with professionals who could support the decision. Bennett and L. 2007 suggest some guidelines to increase the likelihood of client best interest and being served. The therapy is motivated by what the client needs rather than by his or her own needs. The boundaries is maintained consistently with client plan of treatment. The client history, culture, values, and diagnosis have to be considered. The rationale for boundary crossing is documented in the client's record. The boundary crossing is discussed with the client in advance to prevent misunderstanding, counseling with colleagues to guide the therapeutic decision. In the presentation,